So this is great. Okay. So anyway, this was the first slide, and this is why we said to focus on AI. Why does this matter now? Like you said, there's over 4 million short of doctors across the world, and for those of folks in OECD countries, people are aging faster, and you have even more complex care. Within Africa, there's a workforce gap, and I also saw Africa is the providers of young people for the rest of the world. So the demand for African healthcare workers is going to increase, which is going faster than supply. And digital health and AI are already shaping practice globally. AI enables scale, efficiency, and access. And I mean, basically, I mean, one of the things that we think is very critical, and we're very excited to be working with BDU, is that are we training clinicians for yesterday's systems or tomorrow? And if we're training them for tomorrow, which is already today, really AI is already reshaping the way we do diagnosis, clinical flows, and decision making. And so, what does this mean in actual clinical practice? It means that increasingly the clinician's role, is to be an interpreter and a decision leader. So it, you know, and one of the things I know the earlier speaker talked about it, but I mean, I suppose this is one of the challenges. I'm actually in Dakar, in Senegal, so this is one of the challenges, I suppose, of the global momentum. I just speak to countries here, but really the use of AI scribes. I'm sure nobody writes notes anymore. I don't have seen anybody write any notes in the US. And the issue of predictive analysis is increasingly being used. And then for the UK and the way the UK system works a bit different issue of AI trash and sort of augmented clinicians. And there's a mixture of use of different types of AI being used. As some of you may know, I think ChatGPT has developed a sort of health focus because they noticed a lot of clinicians and patients using ChatGPT. But many of the organizations also use of agentic AI so they can develop relatively specific AI issues that address their own specific issues. But as clinicians, this is really and just to show a bit about the AI adoption and some couple of examples, the FDA has approved more than 500 AI devices, and Epic, which is one of the major EMRs in the US, has the Chinese very much on radiology AI deployment. We started during COVID, but also many of you know the Chinese have developed DeepSeek, which was the competition to the um, generative AIs on the West, although DeepSeek hasn't been as trending as the Claude 2. And then this is an example. I also try to take examples from what we had done on webinar, and one of this was Intron Health, where they specifically focused on Africa, and they have a product that supports ambient scribing and all their mouse, but recognizes African accents. So recognizes 300 accents, 20 languages, which is quite interesting and we had. And just to summarize, key areas where people are using in clinical practice: diagnostics and imaging, very high, dermatology, um, those type of areas is one of the areas where AI is sort of leading in practice and is also deployed in the West, but also in several countries in Africa. The second area is clinical decision support, because as care becomes very complex, becomes more chronic and complex. It's really helpful to have decision support. You can tie various things together. For several of you who are clinicians, you know how easy it is to forget some issue happened 10 years ago that may be relevant, maybe for example, they had an allergy, but nothing has happened for 10 years. What's the point we're in ICU to make sure that those things are remembered and they're brought to mind? And this, like I said, in the US has been integrated into Epic or open source like the VA. So people are doing stuff. I've talked about medical scribing, a sort of patient engagement and people are using this to find patients, to take their drugs better, diseases such as diabetes, basically often the monitoring, is immediately sort of collected and at certain levels can be sent to the health system and sort of chat box. But one of the issues actually that's interesting is that the issue of psychologists, there were surveys that looked at young people, and many young people, instead of talking to psychologists, they were talking to chat GPT or whatever about psychological issues. A couple of cases in the US where families are suing um, various platforms, including ChatGPT, for information they may have provided um, to their members. So it's really important, to make that as we'll talk about the issues, but this is really key. This I've talked about a bit, and these were a couple of case studies that were provided on our platform, what we had done. But I think one of the things that might be interesting for the deans or leaders of academics really is the AI literacy models. So, for example, in Harvard, kids are learning prompt engineering, AI ethics, and clinical AI from year one. They start learning about the tools even for this touch patients, sort of extremely disruptive. So I've got back. And so, for example, in Ethiopia, there's some very interesting work going on at the Hassan Research Institute, where I applied to TB research and theology. So, these are examples that we're giving at our environment. But I think some of the things that are really important that they've mentioned that may be important from Africa from the global issue, the issue about a log room. Ethiopia has now started to work in this area. Regulatory frameworks, these are still, very few countries have looked at this, but the EU is one of the most sort of advanced. The US has been a bit more open to allow innovation and the accountability and liability. I mean, so far, when AI gets it wrong, who is responsible? So you need clear governance structure, essential before deployment, and then informed consent. Patients must understand when AI is involved in their care. And so it's something that I think is important. And then government action sort of needed. But I think these things that are really important to consider, the ethical, regulatory, and policy considerations. And for Africa as a whole, there's a leapfrog moment. Just as Africa on the mobile phone. I thought people who did not have the computer revolution did not occur in Africa, but the mobile phone did. And the same way, we probably can also be the first to figure out an AI system that is heavily dependent on smartphones and sort of a mobile first deployment. I think critical for continental white data collaboration, critical training the next generation. We mentioned definitely private sector PPP models, having local AI champions